The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk.
Why are estrogen patches suddenly in shortage? What is going on? Let's talk about this.
You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers.
Welcome back to Sky Women's Health Podcast. I'm your host, Dr. Carolyn Moyers. Today, we're talking about what we're all experiencing right now, whether you're a prescriber or you're one trying to get your patches picked up or you're hearing your friends talk about it, is that difficulty getting your estrogen patches filled at the pharmacy. A recent article in the New York Times highlighted what clinicians and patients across the country are seeing, and that's estrogen patches are in short supply. And it raises the big question, why now? What has changed? Well, for years, hormone therapy use dropped dramatically after the early 2000s study. The Women's Health Initiative created fear about hormones. The headlines at the time were alarming, and many women were told to stop their therapy overnight. But over the past decade, more careful analysis of the data has clarified something really important. And for many healthy women who start hormone therapy near menopause, the risk profile looks very different than what was initially portrayed. And as a result, physicians and patients have been revisiting hormone therapy with a more balanced understanding of those risks and benefits. And it also helps that the FDA removed the black box warning on estrogen products recently. So with that, prescriptions for menopause hormone therapy have increased in the last couple of years. And, the data says 86%, which sounds very dramatic, but the surprising part is that even with that surge, only about 4 to 5% of women are actually taking hormone therapy, or actually using hormone therapy today. So we're not looking at overuse. We're looking at a long overdue access to treatment for symptoms that affect millions of women. Why is the estrogen patch so popular? Well, it's a very commonly prescribed hormone therapy for good reason. It delivers steady estrogen levels. It bypasses the liver. It carries a lower risk of blood clots compared to oral estrogen. But because of those advantages, many clinicians, myself included, frequently prescribe transdermal estrogen when it's appropriate. And, what we're seeing now is a classic supply problem. Demand for menopause and perimenopause care has grown rapidly with more awareness, and that has definitely improved over the years. But manufacturing capacity for estrogen patches did not scale fast enough to meet that standard. So now pharmacies across the country are intermittently out of stock of certain patch formulations. So what should you do if your patch is unavailable? First, don't panic. Okay, I got you. We're going to walk through some of this. The patch is a great option, but it is not your only option. Hormone therapy can be delivered in several forms. And so I mentioned oral, and we always talk about transdermal because transdermal is not going to give you an increased risk of blood clot. So when we look at the average population of women, 2 out of 10,000 women will develop a blood clot in their lifetime. On a transdermal estrogen, whether that is an estradiol gel or a patch or a spray or a vaginal ring, these are all transdermal options. Your risk of having a blood clot remains the same, 2 out of 10,000. Now, on an oral estrogen, that does get swallowed, processed through the liver, and increases your clotting factors. And so that increases your risk of a blood clot slightly. Okay. Now, when you hear my risk is 2 out of 10,000 when not on any hormone therapy, but on an oral estrogen, it's 4 out of 10,000, you think, oh my gosh, that's double the risk. Holy cow. But it's a relative risk because that's much lower than being on an oral birth control pill, which is a much higher dose of estrogen. And that risk is around 9 to 10 women out of 10,000 would develop a blood clot. That's much lower risk than pregnancy, which is like 20 women out of 10,000. And even postpartum period is a greater risk than that. So it's a relative risk. And so for many people, an oral estradiol may be a very reasonable option. The most important thing is not chasing a specific product, but finding a therapy that fits your health, your symptoms, your goals, and also that we can get our hands on consistently, right? So sometimes a good option is simply getting your 90-day supply so that you're not having to chase it every 30 days at the pharmacy. So that can be helpful if you find someone who has a 90-day supply. The other thing that a lot of patients have been experiencing is, well, they gave me a new patch, right? I was getting just a plain estradiol and now I'm getting this dotty patch and it doesn't stick as well. And just for reference, everybody experiences different patches differently. And so some people ask specifically for brand specific dotty. So I'm not talking down on dotty. That's just a very common brand. But these are generics. When I write this prescription, a lot of times I'm writing just estradiol and the pharmacy gives them what they have. And that's fine as long as they keep consistently giving you the same thing. So I always ask my patients to please check your prescription before you leave the pharmacy, because a lot of times you've got that little brown bag and it's already paperclip closed or stapled closed, and you don't necessarily know what you're getting. You're taking on good faith that you're getting your same estradiol patch. Now, what we are seeing is that a lot of the 0.0375 and the 0.075 are harder doses to find right now for whatever reason. And so sometimes we're just evaluating symptoms and maybe adjusting that dose a little bit to a different dosing to get just to more consistently get our hands on the patch. Sometimes it's picking up the phone and calling the pharmacy and saying, well, who in your area has it? And having them look and see. Because here's a little pro tip. You are actually in control of your prescription. And so you can take and move that prescription wherever you need to. And the way you do that is you just call the pharmacy who has it in supply and have them transfer the prescription from the other pharmacy where it was originally sent to. So menopause care, perimenopause care is evolving quickly right now. There's a lot of people who are interested in it. Women are becoming more informed. Doctors are revisiting the science, and the conversation around hormone therapy is changing, but it should always remain thoughtful, personalized, and evidence-based. So as we think about some of these options, I mentioned the estradiol gel. So the estradiol gel packs come in these little individual packs that you just tear open, place on the thigh, rub on a large surface area, wash your hands, let it dry while you're getting ready, either for bed or in the morning. I typically will have my patients pick whatever time of the day is most consistent for them. Or if they're having more night sweats, we'll make sure that we dose it at night. So that is a daily application, and the estradiol gel is not in short supply. You also have the option of the spray, which is Eva Mist, which I find is a little bit harder to get covered by insurance. So it can be a little bit pricier, but the Eva Mist is either 1, 2, 3 sprays. And also we have the vaginal estrogen ring that is only available in the 0.05 and 0.1. And the vaginal ring goes in and stays for 90 days. And so all of these have pros and cons. It's something that you can discuss with your provider. So you have to have somebody who's knowledgeable to help you kind of make those adjustments over time. And anytime we change a hormone therapy, there might be some breast tenderness, some bloating, some bleeding. And so that's something to really be careful about. And we've even seen this in patients who maybe the pharmacy gave them a new estradiol. It's the same patch and it's the same dose, but because it's a different generic, there's a little bit more variation and they might have some breakthrough spotting that was new and they're wondering what's going on. It's the same dose. I don't understand. And usually that's the ticket. That's the thing that has caused their bleeding to return. As we kind of think through this, hormone therapy can be incredibly helpful for patients, but it's got to be that right choice for everyone. And this is why individualized care matters, and having somebody knowledgeable who can help you decide, well, if I'm going to be challenged finding these patches, do I need to pick a different method that might work better for me? So if you're experiencing perimenopause and menopause symptoms, or you've been affected by the estrogen patch shortage, a consultation can help you to clarify your options. So just schedule a consult with your provider. And at Sky Women's Health, we focus on personalized menopause care designed around your symptoms, your health history, and long-term health goals. So you can always schedule a consult online at Sky Women's Health for anybody in the state of Texas and West Virginia. And if you found this episode helpful, share it with a friend, because menopause education is something that we should all be talking about. Also, I wanted to bring to everyone's attention the M Factor 2 that we screened at the office. And several of you had mentioned that you weren't able to make it and you were really hoping to catch it, and we only had rights to it for that one day. It is going to air on PBS on March 19th. So mark your calendars. PBS, March 19th, the M Factor 2, Before the Pause. It's all about perimenopause. It's a quick documentary. Another place besides Sky Women's Health Podcast where you can get some information is the Balance documentary on Amazon Prime, which is a fabulous 4 series following some 2 female monks who are going through the process of perimenopause and trying to find the right therapy for themselves. I think you would find it very interesting, and they interview a lot of the nation experts on menopause. So I hope these are helpful resources to you. Share this episode with a friend. If you're having trouble getting your estrogen patch, please let me know, and I will help you decipher what is going on and what therapies might be better suited for you, so that you're not in this struggle bus trying to keep your estrogen on, because many of us do not want to live life without our estrogen. We do not want to relive the hot flashes and the night sweats. Until next week, be well.